An important tool in chronic pain recovery is understanding the emotions that may be sitting underneath the pain. Very often we feel a physical sensation and we associate it with the tissues that are in the body in that area. So if it's in the shoulder, we might say it's muscular, or it could be the ligaments or the joint feels inflamed. And again, if we've had that pain for a long time, 3, 6, 12 months or more, then very often if there was any tissue damage in that area, and that has then been ruled out, then very often we're left with a neuroplastic pain situation, and this may be related to underlying emotions. So in this video, we're going to look at an emotional awareness technique to delve a little bit deeper into what might be going on in that area other than just musculoskeletal findings. Now, please don't attempt this if you are feeling very emotional, or you're feeling that you don't have the capacity to do this alone, in which case seek out a practitioner either with us or with SIRPA, because it's important that you are in a place that you feel resourced enough to be able to feel into those emotions. So this is for information. If you feel that you have enough resource, enough resilience, and that you are well supported, then you can do this exercise at home. So firstly, what you need to do is get yourself into a position where you feel comfortable, sitting or lying down, just somewhere where you can notice and you're not going to be disturbed. And then what you want to do really with this exercise is focus on the first thing that comes into your head. So we're trying not to get stuck down the rabbit hole of, but it must be this, or it must be that, or it might be the other, and the analysing of it really. What we want to do is really pause after the first thing that comes into our head. So again, sitting there comfortably, take a nice calming breath just to allow yourself to settle. And then just scan your body a little bit like a photocopier or an MRI, where you are going to then just feel for the area in your body that is providing at this point the most sensation. That might be discomfort, that might be pain, could be fizzing, whatever it happens to be, the area of the body that you are feeling is talking to you the most. So just allow yourself to scan through your body and feel which area is the one that's giving you the most sensation. And when you've done that, just focus on that area for a moment. Just allow it to have all your attention. And with the first word that comes into your head, how does that make you feel? Very often when we do the first round of this, that might be a more physical description. It feels tense or tight or itchy, any of those things. But whatever the first word was that came into your head, just sit with that for a moment. Just allow yourself to feel it. Allow yourself to know that it's okay to feel it. Reassure yourself that it's safe to feel it. And just sit with it a moment until sort of the intensity of that passes just a little. And again, if you feel triggered at any point, then stop the exercise and take a few deep breaths and seek some support. However, if you've got to that point where almost you've just taken maybe a little bit of a deep breath, you feel like, oh, I'm a bit more settled with that, that's great. So stay focused on that area of your body and ask yourself again, how does that make me feel? How does whatever the emotion or the sensation that you described in the first place make you feel? And again, the first answer that comes into your head, just sit with that Allow yourself to acknowledge it. Really have a feel of it. But also reassure yourself that it's okay to be feeling that. It's just a sensation. And while sensations can be uncomfortable, they're usually not dangerous. Again, sit with that until your body has said, "Whew, I'm okay feeling that. That's okay." And with whatever your named sensation was from the last round, ask yourself, how does that sensation make me feel? And again, listen to that first word that pops into your head. And just sit with it. Pause. Acknowledge it. Breathe. Reassure yourself that it's okay to feel whatever that is. Now, sometimes at this point or sometimes in the next round, you may come across an emotion that you're surprised about, that you didn't anticipate was going to be there. You might have started with tension and you may have moved on to and worry. You then may have got to frustration. And again, each time, just sit with whatever the sensation or the emotion is that arises and reassure yourself. And then for the next round, ask yourself, how does that anger, worry, frustration make me feel? And again, noting the first thing that comes into your head. Sit with it, pause, acknowledge it. Reassure your body that that's okay. And very often we get to a point where actually an emotion arises that we have been completely unaware that it has been linked to that part of our body. And also actually sometimes that might bring a slightly bigger emotional reaction. There may be a feeling within the body of like, oh goodness, that's bigger than I thought, or there may be some tears. And very often that's the emotion that's buried. That's the emotion that our body has been trying to protect us from. So again, sit with it, acknowledge it, breathe, reassure yourself that it's okay to feel that. It's just an emotion, and whilst it might be uncomfortable, it's not going to do you any harm. And you can repeat this until such time as you feel that you've identified an emotion that's brought up emotion in your body. And if not, if there isn't a great deal of emotion that comes up, just note the emotions that got you there. And these might be things to pay attention to, or maybe to journal about, but even just to be aware of. Because sometimes the pain that the body is producing is actually related to that emotion and is very often not related to the local tissues. When you're ready, take a nice deep breath.